name is Brooke Hildebrand Clubs. I'm the founder of Jimmy's Friends, and I teach at Southeast Missouri State University. This portion of the Let's Take a Tour of the NICU with Little Giraffe is meant for parents and caregivers only. The second part of the DVD is meant to be viewed by you and your child or children together. I'd encourage you to take a look at that before you watch it with them to make sure that you're comfortable and familiar with the content. I started Jimmy's Friends in 2014 in memory of my father, Jim, who when he was a small child, because of asthma, spent a lot of time in the hospital. And even though my dad was a pretty tough guy, he would tell us that because both of his parents had to work, he spent a lot of time alone and lonely. Through my studies in health communication, I've realized that while we have made great medical advances since the 1950s, something that hasn't changed much since my dad was a patient is supporting emotional needs. I decided to start Jimmy's Friends to support young patients and their families. The student volunteer organization Jimmy's Friends does this through providing coffee breaks, developmental care, and sibling care. During our volunteer shifts, our observations led us to realize we needed to make a DVD like this for the older siblings of the NICU patients. A hospital stay can be stressful for anyone, but it can be especially difficult for families when a newborn is hospitalized in the Neonatal Intensive Care Unit. The whole family can feel that stress. Big brothers and big sisters may have an especially hard time understanding why the baby can't come home, why his or her parent or other adult caregiver is at the hospital for extended periods of time, and why they can't go back to the NICU to meet their new brother or sister in person. This video has been designed to familiarize your child or children to the NICU environment when they cannot visit in person, meet the NICU staff, or helpers as it might help your child to think of them, and learn about the functions of some of the tools and equipment that is used to support newborns during their stays in the NICU. Throughout the following video, we will assure your child that the adult caregivers of the NICU are here to help your family's newest member get well. This video is just one of the tools that we have designed to support you as you help your child to feel safe and loved during your family's time here at the NICU. We have also created Little Giraffe, a therapeutic puppet designed to help younger children express some of their emotions about the NICU experience. Older children might want to express their thoughts and feelings by making art, reading or being read to, playing pretend, spending time with one of our Jimmy's Friends volunteers, or spending some quiet alone time. We are here to follow your child's lead and to support them. Our main goal is that your whole family will feel safe and supported during your time here in the NICU. We are here for you. Thank you for your time, and I hope you enjoy watching with your child a tour of the NICU with Little Giraffe. friends. My name's Brooke. I'm a volunteer who helps here in the NICU. I was just making a puppet. Do you like to play with puppets? This one is made out of a sock. I made my puppet to look like a little giraffe. Have you ever seen a giraffe at the zoo? Or maybe in a book? See my giraffe's long neck and its horns? I made them out of brown pom-poms. And now I'm going to put some eyes on my little giraffe. 1, 2. There, little giraffe. Now you can see. I can imagine little giraffe's eyes blinking and winking. I like this black fuzzy material. And I can move my hand around to make him look this way and that way. And I can move my fingers to open his mouth. Oh, I almost forgot. Little giraffe needs a tongue. There. When I play with little giraffe, I can pretend that he is happy, or he is sad, or maybe he needs a hug. Do you like to play with puppets? I've made you a kit so you can make a giraffe of your own. And you can play with it and show how you're feeling with it. But your giraffe doesn't have to look just like mine. You can make it any way you want. You get to choose. Do you like to play pretend? When you play with your puppet, you can pretend whatever you want. You can use your imagination and your creativity. But today I was thinking we could pretend that little giraffe is curious. You know, many of the children that come back to the NICU are curious. They're curious about their new brother or sister that has to stay here at the hospital. And it's okay to be curious. It's okay to have questions. I would like to take you on a tour of the NICU so you can meet some of the people who are helping your baby. Let's go take a look at what's behind the door to the NICU. This is where your grown-ups sometimes go to help the doctors and nurses take care of your baby. The door is locked so that they can keep the baby safe. I have to buzz to get in. The first thing that we have to do is wash our hands. We use special soap like this, and they have a clock here to make sure that we wash our hands for 3 minutes. We do this because if we can get our hands nice and clean, that means there's not anything on them that could make the babies more sick. Now that our hands are clean, we need to sign in. They like for us to sign in so they know how many people are in the NICU, because that keeps the baby safe. It lets them know how many visitors the babies have, and it helps them to keep it nice and calm and quiet. If you ever get to come back into the NICU to see your baby, you'll want to make sure that you are very calm and quiet. Oh, there's my friend, Nurse April. She helps the babies get well. Hi, Brooke. Hi. Nurse April, we were going to show some of the big brothers and big sisters what happens back here in the NICU, and we thought we might take our friend Little Giraffe along to give them a tour.
That would be great. Let's go see a room.
Can you tell us about this special bed?
I sure can, Miss Brooke. This bed right here is a special bed we use to keep the babies warm when they're born very, very early. It's called an incubator. So instead of having to wrap them up in lots and lots of blankets, we put them in this clear plastic bed, and this bed will keep them warm. It also helps keep out some of the noises and the bright lights. Then as they get bigger and they're able to keep their body temperature up and keep themselves warm, then they can go to a bed like this. And this may look like something that you have at home. This is an open crib.
Sometimes we see tubes in the baby's nose or the baby's mouth. Can you tell us what those are for?
I sure can, Miss Brooke. First, though, I want you guys to know that we are very, very careful when we put these tubes in, so that way they do not hurt your baby at all. But we do have two special kind of tubes that we can put into the babies, and sometimes they need help breathing. So depending on how much help they need breathing will depend if that tube actually goes down their throat or into their nose. So this special tube here would go down their throat, and this machine would help your baby breathe until they were big enough to breathe on their own. Or they could have this type of tube in, and this would actually just go right into their nose to help them breathe. The second type of tube is to help them eat.
Why would a baby need help eating?
I know that it seems very easy to be able to take a drink, but babies, when they're born little, sometimes they don't know how to suck, swallow, and breathe all at the same time. So until they get bigger, we will actually put this little tube down into their nose or their mouth, and it goes right down into their tummy, and we can give them their milk this way until they're big enough to learn how to take a bottle.
Thanks for telling us about that.
You are very welcome, Miss Brooke. Now, I think Dr. Barnett is here, so if you would like to ask him some more questions.
Well, that sounds great. We'll go see him next. Thanks.
You're very welcome.
This is my friend, Dr. B. He's a neonatologist. Can you tell us what that means?
Well, I went to school to be a neonatologist so I could learn how to take care of little babies that are sick, are born too early, are prematurely. Our goal is to get them well enough in the hospital so they can be at home with you and have fun playing with you at home.
So when a baby is sick or premature, what do you do to help them get well?
Well, every baby is different. We have to figure out why they're sick so that we can help them get better. It's like a flower. You have to nourish it and take care of it so it can have the opportunity to get better.
How long does it take for the babies to get better?
Well, that depends on the babies too. Sometimes they get better quickly, and sometimes it takes them a long time. It's just like flowers. You have to wait for them to bloom. You don't always know when they're going to bloom, but when you keep taking care of them, it happens.
So what should big brothers and big sisters do while they're waiting for their baby to come home?
Well, babies do sleep a lot, but then when they're awake, they often like to look at pictures you draw or hear your voice on a recording. You might like to practice with a doll at home so you'll be better at taking care of the baby when you get home. Or you could talk to my friend Miss Alicia. She's a social worker.
Oh, that's a good idea. I think we'll visit her next. Thanks, Dr. B. This is my friend, Miss Alicia. She's a social worker in the NICU. Can you tell us what that means?
Yes. A social worker, I went to school to learn how to help people. When a baby comes into the NICU, we have nurses and doctors that help the babies by giving them medicine. I help the parents and the children by providing things that they may need, like a place to stay, or transportation, or something to eat. And if they also would like to talk about anything, I'm here to talk to them as well.
So do you ever talk to kids?
I can, and I like to talk to the kids.
Well, good. Would you like to tell our big brothers and big sisters anything?
I would. I would like to tell you that you might be having a lot of mixed feelings right now. You might be sad, you might be just very worried about your brother or sister that's in the hospital. And we're here for you. I can talk to you anytime that you would like. We also have wonderful staff that also helps. They might seem very busy with the baby, taking care of all of the baby's needs, but we want you to know that you're very loved and you're a very important part of this. So please, we want you to come to us anytime. We also have volunteers. They wear the same color shirt that Miss Brooke is wearing right now, and they can also play with you back in our family room or take you for treats, things like that. So we're here for you, and we want you to know that you're very loved and you're a very important part of the babies' lives.
Thank you, Miss Alicia. So now we took a tour of the NICU with little Giraffe. We met some of the helpers, we saw some of the equipment, and hopefully we were able to answer some of your questions about what goes on behind the door of the NICU. But the most important thing we want you to remember is that you should feel safe and loved.